COVID-19 pandemic continues, parents are among the hardest hit groups of folks trying to deal with it. Here at Johns Hopkins Children's Center, we're so blessed and fortunate to have two experts in this realm to talk with us today about resources that are available to parents, especially those who may be resource challenged. Rachel, would you please introduce yourself?
Well, thanks so much, Elizabeth. My name is Dr. Rachel Thornton. I'm a general pediatrician and an associate professor of pediatrics in the School of Medicine at Johns Hopkins University. It's a pleasure to be here today.
Thank you for joining us. And LaToya.
Hi, my name is LaToya Mobley, and I'm a pediatric clinical social worker at the Johns Hopkins Hospital and the Harriet Lane Clinic.
Thank you. Both of you have a unique perspective, and I'd like you both to frame up the issues as you see them with the patient populations that you encounter.
Sure. Well, I can kick it off. I think most of what you want to hear about will come from my colleague, Ms. Mobley, who can talk about all of the work we do to support families. But I can say as a pediatrician, we consider ourselves really on the front lines of supporting children and families through this difficult time. And when we think about children's health, it's not just their physical well-being that we care about. We care about the whole child. We care about the safety of their home environment. We care about their development, their learning, their nutrition. We care about the health and well-being of their parents. And I think every pediatrician wants the parents and caregivers of the children they care for in their practice to know if families are facing resource challenges, we want to know about it. We want to help them find access to resources that they need. And there's no shame in telling us about the struggles that you're facing. In East Baltimore, where Ms. Mobley and I both work, many families in normal times are struggling with food insecurity, with housing instability, with economic insecurity, with energy and broadband access issues. So we're very familiar with these challenges in normal times, and we know that the economic crisis accompanying the infectious disease crisis facing our country and the world is just compounding these challenges, and many families who haven't faced them before are facing them for the first time.
LaToya, what are you thinking?
So everything that Dr. Thornton said and more, from a social work perspective, one thing we know is that social determinants of health always are they deter people from good health care. So that's why being a medical social worker, I recognize that families, if they don't have their basic resources and needs met, they are less concerned about healthcare issues or going to the doctors or just all the things that should really be important to families. So this time has been very challenging for our families, and we are doing the best that we can to provide the community with those basic needs so that health will still be at the forefront of their minds.
Let's talk about a few of those specifics, about some of the specific needs that you've identified, and then the specific resources that have been developed to help to meet them, and how people can get in touch when they need to do that. If you want to start, LaToya, we'll be happy to hear you.
Sure. So I think one of the main things as it relates to resources, food. I mean, we need food to live. And there are massive efforts throughout the state of Maryland for food resources. So right here in Baltimore City, the schools have led the challenge. Families can get up to 28 meals per week from Baltimore City schools, and the meal sites are throughout the city. The county has the same type of program, and it's all led by the Baltimore County Public School System. But it's not limited to Baltimore City and County, it's statewide. So every single school district has these meal drop-off sites or pickup sites, I should say. And the local governments for the other counties can speak to those programs as well. So if people go on the website, it's very detailed as to how you access food. That has been a huge challenge for community members.
And just to continue the conversation a little bit more when it comes to food, this is an issue from birth through every phase of life. And a big part of the essential services that pediatric practices are providing these days is we are on the front lines of ensuring that every baby who's born gets the healthy start that they need to ensure that they're gaining weight appropriately. The American Academy of Pediatrics has really led the charge in making clear that care, the well child care, the preventive care that we do for young children and infants, the vaccines we provide at all ages are really essential medical services. So when those babies come and see us to get their weight checked a day or two after discharge from the hospital, we are always asking about a family's access to nutrition for that new baby, whether mom is breastfeeding and we need to make sure that mom has access to the food she needs, or whether the baby is taking formula. And so I would love to just see if Ms. Mobley can tell us a little bit more, talk a little bit more about the types of resources available to families for those newborn babies before they get to school. Yes. And then the variety of other resources available to help families make ends meet during the month if they do sort of meet the economic criteria to qualify for food assistance programs.
Certainly. So Maryland Women, Infants, and Children's Program, which is better known as WIC, provides formula to families for newborns. But of course, that's been a challenge as well during the pandemic because all of the offices are operating remotely. So here, most of the social workers, we were able to kind of pull together a book of resources from WIC and find out what their process is. So families are still able to access WIC. They just need to call the WIC hotline and go or call their local office. Most families have been linked into WIC during pregnancy, but even if they haven't, when the baby is born, they just call the hotline. WIC offices will mail out a card to them, an electronic card, and they should receive it within 5 to 7 days. Once the card is received, they will push benefits to the card, and that is for not only baby formula, but as Dr. Thornton said, we want to have mom and families have nutrition as well, so they also offer nutritious food options and healthy options for other families and older kids. It's birth through 5 years old. So WIC has been something that we're seeing a great need for and formula needs. And we have been lucky enough here at Hopkins to have some donations of formula come from the larger system through the Children's Center so that we could also help families who have a gap in the time that the baby is born to the time that that card comes, because 7 days is a long time not to have access to formula. And some of the local pantries in Baltimore have formula as well. So we're able to partner with those pantries to make sure that families have what they need.
Food then, clearly a really important resource. What else has become much more front and center in the framing of the pandemic?
So another thing, and one more thing about food, is there's a big program that I do not want to neglect to mention. It's called Pandemic EBT. So we know that EBT is electronic benefits transfer, which is better known as food stamps. The DHS, or Department of Human Services, is now developing Pandemic EBT, or PEBT, and basically it's going to provide school-age children with the free or reduced lunch that they used to get in school. Now those benefits or funds are going to go right to the parent's food stamp card so that they can use them daily. It has not begun yet. The program is set to start sometime in June. However, it will be retroactive to March. So that means that, for every day that the children were out of school and not receiving lunch, those funds are going to go right onto that card. So some families will get a pretty good boost of finances for June or July.
And on the issue of school, I think this is another major area where the pandemic and the response has really transformed and challenged all of us to ensure that we are aware of the school-related needs, the learning needs that families have all across the country and in our area. The school systems have been proactively identifying children who do not have access to devices to learn on, whether those are smartphones or laptops or tablets. And in the same way that broadband access challenges people's ability to do telemedicine visits with us in the clinic, every time I talk with a patient for a visit, I'm checking to see if their child has been able to participate in school activities and check-ins with teachers, and whether they have access to the devices and the broadband connections that they need to be able to learn. We know summer's coming, It's a time when a lot of children run the risk of losing ground in their education, where safety and supervision and nutrition and other concerns are compounded. And so this is something that's really top of mind. I know that our social work colleagues are always in touch with schools. Pediatricians are always checking on how kids are doing in school. And in normal times, we're doing that. And we're really concerned about children getting access to all the developmental services they get through school, the mental health services, and the learning that occurs there.
Well, what are the resources then that are available to them? Because clearly this is a broad swath of the population who have children who are experiencing all of these challenges.
Yes. So throughout the state of Maryland, you know, exactly what Dr. Thornton just mentioned, it's being labeled the digital divide. The digital divide is not new, but it's more prevalent now that the pandemic has hit. So there are several resources that students can access or families can access. So one, there's a COVID hotline in Baltimore City if a child does not have access to a device. And we have to be clear that when we're talking about a device, Baltimore City and county count a smartphone as a device. So they feel like if a family has a smartphone, then the child can access lessons online. We know that that's not the, you know, best way to access schoolwork, but that is counted as a device. However, if a family does not have an electronic access or Wi-Fi, they can call the COVID hotline, which is 443-984-2000. And outside of that, ironically, trying to get electronic devices, you have to go on websites such as the Baltimore City Public Schools website or the Baltimore County Public School website. And then every other county has their own. Through the principal is the first point of contact. You send an email to the principal from the website to say, I don't have a device. And then they will let you know if the school has technology. Otherwise, there's about 50 organizations. They have formed a committee and they are working to issue devices, laptops, and tablets throughout the city. One person that comes to mind that I refer parents to all the time is Zeke Cohen has been leading the charge. And he's a councilman in East Baltimore, and he has really been issuing a lot of tablets to our families in East Baltimore. So outside of that, Comcast offers $10 per month in internet, but right now it's free to all families. And you know, there's a big push for them to extend it throughout the summer and until kids go back to school. But if they don't, for free, it's $10. And they also will lease, well, really, they're giving out computers and you have to pay monthly for it. Some of our families do not have that extra, you know, 10 or 20 or $50 to pay towards Comcast's computers, but right now everything is free and reduced. So just reaching out to the local Wi-Fi supplier would be a good idea as well.
It sounds to me like the Johns Hopkins Children's Center is really playing a role of almost a hub, and that people can come to the Children's Center and find out where all these resources are. Is that true?
That is true. And that's a great segue for me to talk about the Johns Hopkins Community Connection, which is our resource desk that is housed in the Harriet Lane Clinic and as well as the Children's Medical Practice. And that is a group of undergraduate students led by Kristen Topel, the program director. And their primary job is to locate resources for patients and families at Johns Hopkins. Now, if there's families out there who do not have access to a pediatrician or a medical home or a Johns Hopkins Community Connection, we would be happy to point them in the right direction as well. But the Johns Hopkins Community Connection Desk has been instrumental in being that hub or medical home for families and being able to point them in the right direction. So the Hopkins Community Connection, together with the Children's Center social workers and our wonderful providers, we've been making sure that people have access.
I wonder if you would both reflect for me on the percentage increase in need that you've seen secondary to the pandemic.
I think there's a lot of different ways to approach that, Elizabeth. First of all, given the circumstances, we are very primed to ask about transportation, broadband, and food needs because the response has in some ways limited people's access for good, for good reason, in the interest of social distancing and slowing the spread of COVID-19. And so I can say in our system, we're proactively screening families, particularly for food insecurity. I can say that with reductions in employment, anecdotally in our clinic, and I think this is corroborated by the national statistics, the need for food, the risk of food insecurity for children who are usually buffered from experiencing food insecurity is going up and consistently going up. Every time I ask, every week, new patients, new needs arise, and really the systems are struggling to keep up with these needs, the food pantries. I just want to say, I think that the attention to the role of schools as a place where children get nourishment is really important. And so the new legislation that was recently passed, I believe at the federal level through the CARES Act, to give access to the pandemic EBT in many states around the country is really important, because that's money that families can now use to purchase what they really need to optimally feed their children nutritious foods, where they've previously been relying on what is available either at the meal sites or through food pantries or food delivery programs. And we're in a position at the Children's Center to have a lot of resources to deploy to help identify what's available, to supplement what's available in the community. And I recognize that, community pediatricians' offices really don't have those same resources in a large system at their disposal. And so this is also why it's important for us to, be there to support local pediatricians in identifying the resources that are available. And I think that local providers in the community could consider the resources we have as something that they can look to for guidance on what's available in their jurisdictions, starting with, the county executive's office, the mayor's office in your local area. A lot of offices in municipal government are assembling lists of resources as well. So there's lots of places to find information about what's available, but it's true that it's rapidly changing in every local environment.
It sounds like it's been a really pretty remarkable collaborative effort.
Absolutely. So as Rachel was just saying as well, with the community resources and supporting local pediatricians, one of the things that came out of the pandemic and the collaborative efforts of providers and social workers, and of course, Hopkins Community Connection, we created a resource guide. The charge was led by Dr. Thornton and the Johns Hopkins Community Connection. We normally say HCC. So Hopkins Community Connection with Dr. Thornton and many social workers and other providers have contributed to a resource guide that is on our Johns Hopkins Children's Center website. You have to search under resources and JHH on the site. However, it's a pretty comprehensive guide of community resources. It is changing every day. We try to keep it a living, breathing document and update it. However, it's changing and there are many resources. Some things, as quickly as they come in, they run out. So we are doing our very best to keep those things updated and keep ahead of the curve of what's happening.
Excellent. That ongoing situation, it's wonderful to know that you're both on board. So this collaboration is really very, very impressive. Is there anything else you'd like to add?
Yes, and finally, when we think about our families, one of the main things that is very stressful right now because of furloughs and loss of income, housing and utility payments. Right now, through the state of emergency, the governor has stayed all evictions, which basically means that you cannot be evicted from your home. Families are sometimes confused about that because landlords are stretched thin and they, want to be paid. However, if a family is suffering right now, rent is something that they can, try to pay as they can. We are not encouraging people not to pay at all, but again, evictions are stayed. Utilities through Baltimore Gas and Electric right now, through June right now, will not be terminated or cut off. So that is very important. In the interim, families should reach out to community resources that can help with utility payments and eviction prevention by searching or going to the resource guide that can help them in between time until they're able to pay again.
Excellent. And that resource guide will be available online.
Yes.
Okay. Thank you so much, both of you, for joining me today.
You're welcome.
Thank you.
Thank you.
Hehehehe